Welcome to the third episode of the series, Taking SDGs to the Last Mile, in collaboration with Center for Climate Studies, Manipal Academy of Higher Education. In today's episode, we are going to be discussing about smart city governance. We have with us today two experts with us, and it's my honor to introduce both of them. We have Dr. Anjali Karol Mohan. She is an urban and regional planner by profession with a PhD in urban governance from International Institute of Information Technology, Bangalore. Her broad interests of practice and research include development, urbanization and urban management, public policy, information and communication technology, and development. She has engaged with various urban planning and urban management exercises. Thank you, ma'am, for joining us today. It is a pleasure to have you with us today. Our next speaker and expert is Mr. Abhiyant Tiwari. Mr. Tiwari is an assistant professor and program manager at the Gujarat Institute of Disaster Management. He is trained as a Master of Public Health with a specialization in environmental sciences from Harvard T.H. Chan School of Public Health. He has worked with knowledge and policy partners on developing, scaling heat waves, health adaptation plans in India. He's a member of National Disaster Management Authority of India's Technical Experts Group. Thank you so for joining us today. It's a pleasure to interact with you. So I'll start off with asking you a question about the current scenario that we are in. So we are currently in a public health emergency that we are experiencing due to the second wave of the COVID pandemic. So my question is, how can we work on improving our public healthcare infrastructure? And do you think digital technology can play a role here?
So thank you so much, Pratna, Dhanshri, and all the members for having me and Anjali ji on this very important and timely podcast. To your question, which is exactly very pertinent in the time, that how can we use the digital technology in leveraging the public health services, especially in the current times of COVID. See, digital technology has always been a strong tool to enhance uh, the essence or the delivery of public health, the healthcare services and public health particularly. If I talk about public health, what we mainly focus is on primary healthcare when we talk about preventing the health from adverse health events. And the three important pillars of primary healthcare are accessibility, affordability, and quality of healthcare. And the role that digital technology plays in all these three pillars is widely used. For example, in preventing diseases, there is a role of digital technologies in diagnosis, and we are seeing that countries have used different AI tools to enhance the diagnostic facilities in times of COVID-19, when we have a lot of patients coming in for COVID with COVID-19 like symptoms. So if technologies can be used to enhance the diagnostic facilities, that is one thing. Second, the technology is also in use in treatment, widely in use in treatment. We have seen a great improvement in the delivery of treatment over a period using the technology, where there are advanced machines available now. We have seen robotics coming into the operative procedures as well. So yes, there is a role of technology in treatment. Talking about affordability, which means we can decrease the cost of services that we can provide. For example, and also about the accessibility, we have seen the examples of telemedicine which are in use at current scenario as well, to reach out as many as people possible. We have seen the examples of mobile health services. For example, the mobile vans which are providing services to the farthest area or the last mile of the society, where we cannot easily reach. So we are reaching out to them through the use of mobile vans and taxis. So
I think we lost Mr. Tiwari due to some connection issues. We'll come back to him later as and when he joins. So, yes, Dr. Anjali, my next question is to you. So, in 2018, the UN surveyed countries in assessing how they use e-governance to achieve their sustainable development goals. So I wanted to understand how can we connect e-governance to sustainable development goals, that is the SDGs, and how can we use e-governance to achieve our SDGs in a much better way. Yeah, you have to unmute
Yeah,
yourself. Yeah.
thank you for to you and to Dhanishri for reaching out and giving me this opportunity. So, given my experience in the urban, I will choose to answer this question from the perspective of the urban and governing the urban. So, as we all know, the SDG 11 is directly talking to the goal of sustainable cities and communities. But then there are several other goals amongst the SDGs which talk or intersect with this larger goal, SDG 11. You have SDG 1, which talks about poverty, reducing poverty. I think SDG 6 talks about water and sanitation. Then you have an SDG, I think 13 on climate. And then there are one or two SDGs. If I'm not mistaken, 16 and 17, which speak about governance. Now, what the SDGs also do is that they embrace innovation and technology, especially information and communication technologies, and they pledge the role of information and communication technologies in making cities livable and sustainable. Having said that, the whole concept of sustainability, the idea of development, or the debates around development and attendant goals, as well as the debates around governance and even e-governance, in many ways predate the whole the debate on the SDGs. So in some ways, I'm not able to fathom this euphoria we have on the SDGs. To me, and many people have said that it's really old wine in a new bottle. Nevertheless, it does not make the SDGs any less important. In fact, I feel in the current context of the pandemic, they have assumed a heightened criticality. Essentially, these are basically basic development goals, and these should be the function. They have been the primary responsibility and should be the primary responsibility of all governments. Now, having said that, we have not been able to, in the Indian context, we haven't achieved these development goals even after 7 decades of being a sovereign nation, and this is a point of concern. Um, so I think the fundamental question is why we have not been able to achieve these, right? And while I would like, the answer is in itself, the question in itself is very complex. So the answer also would mean, dealing with this complexity. But putting that aside, I would like to, within this larger context, I would just like to go back to your question, which says how can we connect e-governance to SDGs, and how can e-governance contribute towards achieving the SDGs? See, the two are intrinsically connected, and clearly technology has a role to play in as far as achieving these goals is concerned. Um, Historically, we all know that as and when technology has been developed, it has been leveraged to, make to the benefit of humanity, to the benefit of citizens, society, human beings. And ICTs also have a similar potential. There is enough and more evidence to show that ICTs can be used as a tool, as the previous panelists also said. It's a tool and not an end in itself to achieve the SDGs. So I think that's the first thing that we need to keep in mind. They can assist governments in managing or delivering on livable cities. However, what needs a foregrounding, and this is where I would like to draw attention to the listeners today, is that there has to be a clarity on understanding what should be the role of the state, what is the larger vision or the goals that the state has, and what kind of organizations and institutional frameworks, essentially the governance frameworks that it has put in place to achieve this larger vision. And this is a structural or a systemic reform that is required. Unfortunately, whether it's the SDGs or the policies and programs on governance or any development goals, we don't tend to engage with this larger structural and systemic reform. And I think that's where we are lacking. So essentially, when we say that ICTs, and that's what the whole e-governance literature says, that ICTs will help to do, literature as well as policy will help to deliver on the SDGs through enhancing accountability, through enhancing participation, efficiency, transparency. I think it's too much of a broad brush. What we need is conceptualizing structural and systemic changes while leveraging technology as a tool to achieve these. The structural reforms and systemic changes is really the need of the hour, and that's where we are lacking. So let me just kind of end by illustrating this point that I'm trying to bring out here. It is well accepted that the sustainable development goals have to be implemented at the local level, right? So they're very, very local in their implementation, as well as I would say should be local in their conceptualization. But anyways, the principle of subsidiarity, that is bringing governance closer to the people, is very critical in achieving the SDGs. What the principle then requires by extension is very strong municipal and sub-municipal governance institutions that are capable of, for instance, in context of the question you have asked me, in context of e-governance, these governance institutions, municipal and sub-municipal level, should be able to leverage say data-driven decision making. So if we ask this question that are they capable of doing that, the answer across the board is no. And that's because we have weak governance institutions. So I think the point over here is the need for structural and systemic reform. And that in this context would mean actually instituting local governments which are strong and capable in themselves, having the capacity to leverage technology to discharge on their roles and responsibilities.
Thank you so much, Doctor, for putting things out in perspective and explaining how technology can play a pertinent role here. So, Mr. Tiwari has joined us back again. You can continue about, we're talking about the role of technology in public health.
Yes, thank you so much, and I'm sorry, I don't know how it happened, but it's really unfortunate that it happened in the question of technology itself. So yes, what I was trying to emphasize upon is that technology do have a role. We are utilizing it, but as I was listening to Anjali ji also, that the sustainable development goals has to be at local level. So as the the use of technology has to be at local level. So we need to ensure that there is no technology divide at the first place when we talk about utilizing the technology in health or in any other area of development for that matter. So if I talk about the data, recently a report came out which says that the penetration of mobile and internet technology so far in India has been only 40% as compared to 80% in US or more than 60% in China. So we still have to work a lot in enhancing our reach to technologies, especially the mobile and the internet services. If we talk about increasing the accessibility of the digital technology in health, but we have seen examples of better use of technology in healthcare in COVID times, especially the national Arogya Setu app that we all have downloaded and used, which has been very useful in the first wave. During the first wave, not so much, unfortunately, so far in the second wave. But last night, our PM, emphasized on the local micro containment zones, which were in the first wave also driven by the Arogya Setu app itself. If some of the people know about it, so people were able to self-assess their health status, and then the policymakers were able to understand where are the people at high risk and which are the areas at high risk which need to be contained. So those kind of technologies were used in timely surveillance and containment of the COVID-19 outbreak in the current pandemic itself. In fact, we in Gujarat also, from my institute, we initiated an mobile technology based COVID COVID surveillance app. It's a surveillance app which engages different stakeholders, the drug controllers, the health authorities, the district administrations, and the people and the drugstores. The idea was that there is a high prevalence of self medication in India. Unfortunately, as high as 90%, even in the urban areas like Delhi. What does the self medication means? That people tend to go to the drugstores at the first place for their primary or initial symptoms, and take the medicines directly from the drugstore rather than going to the healthcare providers. And there are many reasons behind that, including the cost issue, of cost issue, of time issue, of literacy, and in stigma, issue of stigma in some cases, for example in TB, and for example in COVID as well. So people were afraid of going to the healthcare provider and asking for a treatment if they had fever or cold, because of the stigma around COVID. So this is what we thought can be a good initiate point to initiate with, and we developed this technology where whosoever is reaching out to the drugstores with the with the pre-defined cardinal sign and symptoms of the COVID-19 were supposed to provide their information using the current acts which were in place during COVID-19, the Epidemic Act and the National Disaster Management Act, and were supposed to provide certain basic contact informations to the drugstores, and they had to enter those information in real time in their application developed for this particular surveillance system, which reaches to the healthcare provider of the concern. So when the patient provides the data, the patient provides their residential area, which has a the pin code, and that pin code is already assigned to a particular healthcare center, a primary healthcare center in rural setups, or an urban healthcare center in the urban setups. So in that case, the information reaches to the healthcare provider, to the primary healthcare provider in real time, and they can send their team for further assessment of COVID-19, for testing and other things. And that way we were able to trace and track the cases in the real time and contain the cases in several districts in Gujarat. So yes, this is I wanted to share from my experience at the local level.
Yes, thank you so much, Mr. Tiwari. So, because you have worked in scaling and implementing health heat waves adaptation in India, so when it comes to disaster, the examples that come in our mind is maybe floods, cyclones. So, heat waves do not specifically come in the Indian minds when we talk about disasters. So, could you give us some historical context as to how the study of heat wave was developed in India and why it is important? And could you also take us through some of the challenges that you faced while formulating the heat maps?
Oh yeah, thank you so much. Actually, this is very important question. Again, pertinent because we are not just amid the COVID crisis, we are also amid the extreme heat weather season in India, and most of the states in India are prone to extreme heat. In fact, from less than 10 states back in 2020, 2015. According to National Disaster Management Authority, there are more than 23 states now which are prone to extreme heat. So yes, our exposure has increased. If I just talk about some of the data, the recent data, why it is important. According to a recent Lancet report, there are more than 300 billion work hours lost in 2019 as compared to 199 billion work hours in year 2000. And out of those 300 billion work hours, India alone lost more than 39% of work hours, which is close to 118 billion. So work hours lost mean loss in productivity, loss in economy. And if I talk about the impact on health, as compared to 2000 in 2016, there were around more than 125 million people who were exposed to the heat, and as compared to 2000 in 2018, more than 54% people, especially the elderlies, died because of extreme heat. So this is the quantum of risk that extreme heat, poses on public health. Talking about our experience with working on heat wave, we started back in 2000, from the experience in 2010. So I live in Gujarat. I live in the city of Ahmedabad, and we had a massive heat wave in 2010 in Ahmedabad, which caused more than 1,300 excess deaths within a month of May 2013, as compared to the same month in a year before and in a year after. So we had an increase in death. We had a massive heat wave in the third week of May, and simultaneously we saw an increase in numbers of emergency ambulance calls, uh, along with the increased number of all-cause deaths. So that was an alarming call for us. The city government, mainly the health department, was ready to work on this because they have seen the emergency. So what we are seeing right now, not that bad, but we have seen the bad situation in our emergency rooms, the government emergency rooms of the government hospitals during 2010 heat wave. So the city was ready. We were the academic institutions. At that time, I was working with the Public Health Foundation of India's institute in Gandhinagar, Indian Institute of Public Health, Gandhinagar. So we were ready to help the city. We had other knowledge partners like Natural Resources Defense Council from US, and the local meteorology department, and other partners who work together in developing local solutions, which are on the basis of international expertise of other countries, but which were tailor-made. So we developed the first heat wave adaptation plan for the city of Ahmedabad and implemented it in 2013, which had simple solutions like building community awareness and reaching out the vulnerable communities and building public awareness, initiating an early warning system, which was an impact based early warning system, which means it was based on the thresholds which were determined locally, the temperature thresholds which were determined on local data. We initiated capacity building programs, and later in the third and fourth year of the plan, we included long-term measures like initiating adaptive measures and reducing the exposures by measures like cool roof, which are not just preventing the extreme heat risk but also helps in mitigating the extreme heat risk. Challenges that we faced, yes, it was difficult to initially work with different departments of government, because heat is not the priority of everyone, right? But everyone has a role to play in it, uh, for any other hazard, for that example. So letting the electricity department people, or letting the parks and development department people, to make them understand their role in preventing the extreme heat to health, of heat to the health, was important and challenging for us, but we somehow overcome on it by continuous hand holding, continuous partnership, and that is what worked. And we are great that the work was appreciated well at the national and international platforms. And from one city in 2013, now we have more than 23 states and more than hundreds of cities and districts in India who are working with the National Disaster Management Authority and Indian Meteorology Department and local agencies, government agencies, in developing their local heat health adaptation plans. Yeah.
So thank you so much for talking in detail about how the heat wave study has been carried out in India, and it's great to interact with you as someone who has worked primarily on that. So my next question is for Dr. Anjali. So you just spoke about the systemic reforms that we need to bring about when we talk about e-governance, and we should define what should be the role of the state. So that brought me to another question that I had is, what is, or rather what should be the role of the private sector? Because private sector is known to innovate technology, and so my question was, can there how should the responsibilities be divided between the private and the public sector when it comes to e-governance?
Uh, yeah, I mean, thank you. I mean, that's a pertinent question. The private sector definitely has an edge in developing and innovating on technology. It is a skill that is not traditionally or historically found within the state. So therefore, collaboration becomes very critical, and we are seeing that in most of the e-governance interventions. The policy also emphasizes the need to collaborate. Uh, Yet, I personally feel that the whole neoliberal agenda has taken this to a different level altogether. So the states today prefer to be service enablers rather than service providers. Now, what does this actually mean, especially for the poor, the marginalized, and the vulnerable in our cities? And that's a substantial number in most of the larger cities, also in the smaller cities. So, and there has been enough and more failure of the markets to service this segment of society, right? So the markets are there, they are able to service and work along with governments. But when it comes to, for example, servicing the poor segments of the society, it's not very forthcoming. And we cannot blame the markets because their objective is to make profit and they are doing that. It's the state which has the primary responsibility of it has to assume the primary responsibility of servicing this segment of the society, because this is the segment that cannot also service itself or has cannot access a lot of services on its own. So I do believe in this whole idea of partnerships and collaboration, collaborative governance. In fact, it has been a line of inquiry both within my practice as well as in my research. It was the topic of my PhD research. What I do know is that most of the problems of social policy are wicked in nature. So it's when we say they are wicked problems, it's difficult to address these problems through a singular engagement or through a single skill. So therefore, collaborations, these need addressal through multiple along multiple dimensions, and therefore collaborations become very critical. But what I would like to emphasize is that you need collaboration that hinges on co-production. Right? What Mr. Tiwari also mentioned, this co-production, whether this is in terms of knowledge or in terms of solutions, actually, I would go a step back and say that you need collaboration first to be able to frame the problem adequately, and that's where it is very very critical. And but I do feel that in the Indian context, and especially in the context of the global, also in the context of the global South, where marginality as well as informality is rife, even within any collaboration, the state has to be in the driving seat. So you do need a capable state, do need a capacitated state which is able to steer and which is able to direct markets to help it to deliver on its agenda. And I would actually take the debate a lot further. Why only states and the market? You know, there is the community, there's the civil society, there is academia, there is technologists. You need to collaborate with technologists to bring in technology which is most it has to be appropriate, it has to be relevant, it should be speaking to the field, and therefore, and these technologies need to be designed, and all these people have a role to play. But I go back to what I said earlier. I argue for the state to steer this collaboration, and this is very very critical, essentially because it is the state which should and can be held accountable in numerous ways. So therefore, I think the state is where the visibility of the state, the role of the state is very critical in this collaboration, whether this is with a singular stakeholder like the market or multiple stakeholders, which is cutting across the larger society.
I think you answered that with keeping in mind the global South scenario, and that really answers the question. So thank you so much for elaborating in such a detailed manner. So my next question is for Mr. Tiwari. So it is estimated that by 2015, about 800 million would be living in urban settlements. So in this context, how important it is to evaluate our various disaster management responses. So because a live example is being played in front of our eyes right now, with many cities being the worst hit in terms of pandemic. So how should we plan our disaster responses in a better manner?
Yes, thanks, Ratna, for coming up with this very important question. Actually, this is not pertinent. This is not just pertinent, but also futuristic. So, yes, you correctly said that there are estimates that in India, more than 800 million people will be in the urban setups by 2050. And if we talk globally, there would be more than 70%, around 70% people who will be living in the urban areas, which means there would be when we talk about disaster, we talk about four important things: uh, hazard, vulnerability, exposure, and the coping capacity. And when we are talking about more urbanization, we are talking about more and more people and assets getting concentrated in a given geographic area, which means if a hazard, for example, if an earthquake strikes in an area which has lesser population density, is going to be less damaging as compared to the area which has higher population density and has higher assets, which means more people and more assets are exposed to the hazards. So definitely we have higher risks when we are talking about getting more urbanized. We are talking about future when our majority of the people will be living in the urban areas. But then we talk about high risks, we should also talk about high risk literacy. We should encourage risk literacy right from the I would say elementary education itself, because that is where we lack a lot in unfortunately in our Indian education system. We need to literate people more about the risks that they put themselves and their community into when they take different decisions, including moving to an urban area for livelihoods, for example. And we saw that we saw a massive reverse migration during the time of COVID-19 pandemic. Had those people any idea about such scenario to happen, that can happen to them in the urban setups when they decided to move from rural areas to the urban areas? In fact, we had reports back almost more than uh, a decade back from the World Bank, if I'm not wrong. It's a global risk report, which very well warned, alarmed governments across the globe that there could be lethal flu-like pandemics in the coming times, with the rate of globalization that we are seeing, with the rate of travel, especially the air travel that has been increasing in the global uh, uh, globalized world. So that poses a great risk to us, and we need to work on that. We need to work on not just the sustainable development goals, but we need to work on the coherence between the recent global agreements that happened at the same time. For example, not just SDG, but also the Sendai framework of disaster risk reduction, also the COP 21. So these all has to be looked at in coherence, in synergies, and worked upon at local level. So that is where it is important to work in coherence to address the issue of risk in the urban areas in the times to come. Yeah.
I hope like after the pandemic, the government does take risk literacy more seriously, and we do have it in syllabus. Like it is very essential now to understand it. So my next question is for Dr. Anjali. Dr. Anjali, you spoke about how the state should play an important role in the global south with respect to marginality. So that And so that brings me to another question. So you were part of the series called as the Southern Tilt in the Urban. So it's sought to innovate and develop context-specific planning that acknowledge the global South. So what do you think? What roles do the knowledge system play in urban planning, management, and governance, particularly with reference to the cities in the global South? You have to unmute yourself, ma'am.
So, in general, any knowledge system constitutes the backbone of effective planning and management of cities, for that matter, any discipline. But I think a pertinent question is perhaps what sort of knowledge systems? And that is what this seminar series that we conceptualized and implemented sometimes in 2019 and last year, early, just before the pandemic. Uh, this was across the cities of Medellin and Bangalore, and the focus was on the southern city, the 21st century contemporary city, where debates have been that this is the city of the future. And but at the same time, it's very discernible that this southern city is a messy site. You know, it's replete with the contestation. So while it is exalted as a center of wealth and innovation, it is also a geography which is hugely compromised along many dimensions. And the framing of the SDGs themselves is evidencing this. Now, the recent past, we have seen a huge scholarship which identifies the fault lines along what we call the borrowed or the imported planning models, which have reached countries like India through processes of colonization. And generally, there is this debate that it is these planning models which are uh, responsible for amongst other things, but also largely that they are inappropriate and irrelevant to managing the contemporary city. And this is primarily because one, the southern city has witnessed unprecedented urbanization on one hand, and on the other hand, it also embodies a huge diversity, social and cultural diversity, something which the early urbanizers of the global north have never experienced in the past. And therefore, the models that we have borrowed or imported from these contexts are not capable of interacting with these two phenomena, which is characteristic of the southern city. So uh, so the the whole premise of the seminar series, as well as we're coming out with an edited volume on that soon, uh, and this is what I keep arguing, that there is a need to look inwards. So, what we say is that we need to foreground the historical and contingent geographies of the southern city and start looking at some of its characteristics, the socio-spatial signifiers of the southern city, which is your slums, your urban villages, your peri-urban, your sprawls. And within the formal planning processes, these are always positioned as the other. No? So there is the unplanned, there is the informal, and planning and governance, the formal planning and governance tools actually either do not acknowledge these, or if at all they acknowledge them, then they are looked upon or identified as sores which need to be removed or obliterated. So, what we argue is that these spatial forms in themselves embody a lot of locally rooted knowledge, right? And that is the knowledge system that has to be elicited, that has to be made a part of the larger planning process. And so, therefore, what sort of knowledge systems are critical? Definitely the locally rooted knowledge is very, very critical. And that's where I then go back to my earlier uh, argument of systemic and structural reform deriving from the principle of subsidiarity. So, to that extent, I think these these knowledge systems are very important. And again, it is here that technology can and has played a role, at least at the pilot scale. But what I would like to say here before I conclude is that I'm not constructing binaries over here. So I'm not saying that there is this top down knowledge system which is not critical and there's a bottom up knowledge system which is much more important. No. Both are important and both need to speak to each other. In the current context, the top down knowledge system that planning relies on is outdated, is inappropriate, and is irrelevant by virtue of having emerged in another context. The bottom up currently is missing, and that's what we need to elicit and we need to bring into the formal planning processes, and that's what the seminar series was all about.
Yeah. Thank you so much for answering that question, because I think I agree when you said that, along with top down, we also need down to bottom approach to work in synergy when it comes to knowledge systems. So yeah, thank you so much for answering that question. So my next question is for Mr. Tiwari. So you quoted a Lancet study which talked about how heat waves have impacting our work hours, and especially how it has impacted work hours in India. So I also came across this study published in the journal Geophysical Research Letters, which has mentioned that deadly heat waves will become more common in the coming decades in South Asia. So I was wondering how we can create an international and a South Asian network for cooperating and tackling on heat waves.
Oh yes, Prashna, thank you so much for again. I mean, these are really important questions and very interesting. In fact, Dhanashri would agree. Dhanashri was one of the co-fellow with me in one of the recent South Asian Heat Health Summit that happened in Pune. I guess in 2020 earlier in 2029. So yes, there is a need for regional cooperations on this, and why so? South Asia again being uh, one of the most vulnerable regions when it comes to extreme heat, definitely need more resources, more knowledge, more expertise to be roped in. Uh, from our experience in India, we helped our neighboring countries in terms of knowledge sharing. Uh, Friends from Pakistan reached out to us, friends from Bangladesh reached out to us for developing their heat health adaptation plans. There are networks which work at the regional scales. There are corporations that are at the regional scales, for example, BIMSTEC, for example, SARC, which can be leveraged upon for regional partnerships and regional practices. And it's not just for heat; it is also important uh, for other hazards as well, including the pandemic, that we work at the regional level, plan our future development and risk scenarios for the regional level, like plan our trades accordingly, plan our travel treaties accordingly, which decrease our risk to different hazards, and we can work at the regional level and work with the global partners, global agencies like WHO and UN, uh, uh, to 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 not just tackle heat wave but also other hazards, for that example. uh, so yes, there are cooperations that are coming up for heat wave. We are planning to develop a South Asia Heat Health Information Network, which will be a part of a global network which is called Global Heat Health Information Network, which hosted this South Asia Heat Health Summit in Pune in 2019 or 2020. I'm getting confused with, like, this entire COVID year has been vanished from our memories. So yes, it was in February 2020. Pardon me. So we are in stage of developing a regional cooperation on heat waves, which will be called South Asia Heat Health Information Network, which will work along the Global Heat Health Information Network, which is a group of scientists, policy experts, experts from academia, from practices, working at WHO, WMO, and at different universities and governments. So yeah, that's it. That's it. Thanks.
I hope the South Asian network also helps to interact bilateral interactions between all the countries, and we are able to tackle heat waves in a much more in a much better way. So that brings me to the last question that I have today for Dr. Anjali. So, we were talking about how technology can help governance and public health. So I came upon this information that Uttar Pradesh Chief Minister Yogi Adityanath has started an e-office where he monitors all the workings of the department through Darpan dashboard. And similarly, Shillong has adopted a declaration outlining a roadmap on e-governance. So, how do you think in city administrators emulate a similar framework for their cities, and what do you think are the challenges associated with it?
Okay, so I will start with the challenges part to begin with, and that is that we do not have full and robust city administrations anywhere in the country. So that itself becomes a challenge, and first we need to create these. That's what I said in my previous answers also, and definitely, technology is a tool to create a robust administration. However, what we need to understand, and that's in terms of the challenges, that technology is not the only tool. There are several other things that are that are required. For instance, you require forward-looking, for example, forward-looking legal framework where municipalities are 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 there is a allocation of functions, and there's an allocation of funds, and there's an allocation of functionaries, which is then makes the municipality strong. And this is the structural and systemic reform that I'm talking about. E-governance interventions are being conceptualized and implemented since the late 1990s. JNNURM took it in a big way. Karnataka actually was a forerunner in the country much before these reforms e-governance reforms were spoken about for implementation at the country scale. The dashboards, they are the new baby in the bucket. In some ways, it's the new arrow in the quiver. So, and most states and district administrations have these dashboards now. The objective is to generate data and to make data-driven decisions. And it's a very laudable objective. Nobody can argue against it, and that's much needed. Many cities and GPs are also, Gram Panchayats are also aspiring towards such dashboards. However, in the case of local governments, the challenge is really from whose lens such dashboards would be constructed or designed from. For instance, both the state government and the local government, just to put it in perspective, they have their own roles and responsibilities. They have their own mandates. These are, for example, for the state governments, they have to monitor local governments, right? But the local government has to service the citizen. Now, because the local government is a function, is in the state list. So many a times when you're constructing this dashboard or you're putting a technology reform, it is largely done from the lens of the state. So what that essentially means then, what it manifests or translates into is that the local government, in dealing with this dashboard, is always always accountable to the state, right? So there's an upward accountability that gets put, that finally it manifests on the manifests in instituting an upward accountability. We put it that way. The downward accountability to the citizen, that gets compromised in the process. And that's also because local governments are not strong in themselves. So these are some of the challenges, when you're looking at dashboards or any sort of data-driven policy or program or decision making. And unless we don't start to institute strong local governments who are autonomous in themselves, who are able to think and drive, for instance, just the dashboard design, saying this is my responsibility, it is more to the citizen than to the state, or I should be able to balance these responsibilities, I think the challenges will continue to stay. And I go back to saying, I'm sorry, at the risk of repeating, these are the structural and systemic reforms that we require for many of these things to go ahead.
Yeah. Thank you so much, Dr. Anjali, for...
Also, just very quickly, the Shillong Declaration. Sorry, I just remembered that. The Shillong Declaration that you make mention of. So if you look at that declaration, and I was also referring to it just before came onto this platform. It also says the opening line is that the central and state governments would collaborate to improve the experience of the citizen with government services. Now, the question is, where is the mention of the local government here? And it is the local government which is actually administering uh, municipalities. So there is no mention of the local government at all, and that's because the local government is a function of the state government. So from that perspective, I think it's very critical to start bringing in some of these reforms around the local to meaningfully leverage the positive impacts of technology. Yeah, I'm done.
To the discussion. So thank you so much for sharing. And to just sum up the technology, the bottom. I hope I'm audible now.
Yeah,
There's some
Uh, your voice is
connectivity
breaking,
issue.
Pratna.
So,
yeah, yeah.
Yeah.
Your voice is breaking.
is it better now?
Yeah, better.
Yeah.
All right. Yeah. Yeah. Okay. Is it better now?
Yeah.
Yeah, it's better now.
As I was saying, talking about such pertinent topics. So just in order to sum up the discussion for today, we spoke about how use of technology is very important when driving decisions. We spoke about important on the need for risk literacy, that is takeaways for today. And we also spoke about how there is a need for the state to play a role, especially in developing countries of the global south. And last but not the least, the need for robust local administration and the need for systemic reforms. So thank you so much, Mr. Tiwari and Dr. Anjali, for joining us today and giving your insights on such a pertinent topic. So also thank you for the viewers for joining us live. I hope you were also able to take some insights as I was able to learn from this conversation. So yeah, thank you so much for joining.
Thank you.
Thank you.